Eli Lilly says it learned to be a lot more mobile during the pandemic, even going to nursing homes to provide care for residents on site. So now the company is pivoting and applying that model to change the way that it recruits for research by hitting the road in RVs. Recently, I took a tour of one of the 20 RVs that Lilly has reconfigured into mobile labs. The goal is to reach rural and/or underserved communities that are unaware of and lacking access to medical research for cancer, diabetes, Alzheimer's.
But in so many diseases that we're studying, research is not necessarily a core part of the option that is provided in the healthcare system. And so really improving the ability of patients to know all the options available to them, but more importantly, making it accessible. One of the #1 reasons why only 5% of the entire population in the world ever participates in clinical research are barriers to accessibility. It's hard to get to, it's hard to find. And so opportunities like this, where we can bring research to them, decreases those barriers and increases the flexibility, allowing more patients to participate.
While I was there, I ran into Bill and Judy Asbury. They signed up for an Alzheimer's study.
It's a terrible disease, in my opinion. My mother had it, and I felt like I lost her 5 years before she actually passed away. And that's really a terrible experience to go through.
Lilly is trying to determine if a simple blood test could detect Alzheimer's and potentially replace the current and expensive imaging that is often only available in high population areas.
If we can get 200 participants in the study, that will allow us to say, here's what normal looks like, and here's what abnormal looks like. And that will help us make a definitive determination of, can we detect Alzheimer's with a simple blood test?
Making the disease easier to diagnose and earlier is progress.
There's a tremendous amount of research within our organization as well to see what can we do to proactively treat onset of symptoms, as well as delay progression of the disease and illness. And the hope is that one day we will have a cure.
My brother-in-law has it. Just got out of the hospital. He's back in the nursing home. It's terrible.
And that's why the Asburys want to know where they stand and potentially help change the course for future generations.
And since it runs in our family, he said, and I feel like I need to know, and I would like to do anything we can to find a cure for Alzheimer's.
Lilly hopes to enroll 200 people this week for the study. It includes the blood test and also would cover the cost of a PET scan. So you're eligible if you're 55 or older. If you want to learn more, if you want to enroll, call the call center. The number is 187 right there on the bottom of your screen, 693-9609. We also have this number posted for you along with the story online at WTHR.com.